a lot of the time, if you just give the person that impetus, that, sort of create that foundation for health, then a lot of things get better. So sometimes things are metabolically out of balance, their blood sugar is out of balance, their thyroid's like not optimal, things are just not great. They're not necessarily, it's not diagnosable as a disorder or a disease, but things are just not optimized. And so in those cases, sometimes, like I said, if you just give somebody a homeopathic remedy and some like good quality vitamins, things get a lot better. And then they don't need to be on a bunch of other pills for a bunch of other problems because their body has already started to heal itself.
As you're working with the natural, like, how do you know if a patient is becoming over medicated as you're doing things that might start to help them heal? How do you know that?
I love this question. That's actually one of the ways that I can tell they're ready to taper, because we look for new side effects that they didn't have before that are common side effects of the med, or some sort of, the person feels like more drugged than before. And that's the best way for us to know, okay, great. Now your body is saying, I have too much of this drug. Before it was just enough to keep my stuff, my symptoms suppressed. And now it's too much. I'm over medicated. So a very common one is fatigue. That's a super common one, like oversleeping, overtired, new sort of cognitive symptoms, like can't think. The taste of the medication in your mouth, that's kind of amazing.
That was a really weird one.
Yeah.
I'd never had
your
that
body was trying to get rid of it. So it was like coming out in your saliva. So and that's a really common, like a metallic taste or a sort of a funky taste in the mouth. That's one of the most common drug side effects. And so the fact that you weren't having that before and then you started having that, that's a really good indicator that it's time to taper. Yeah.
So tell me I have one more question. When you go through this process, like what are I want to ask a little bit more about this intake because I'm super interested in it. What do you do? You mentioned lab tests. How do you know if somebody, like if you're going to do lab tests, or how do you know what direction to go? Like what are the kind of the things to say?
So there's a really big spectrum of what causes mood disorders, and on one end of the spectrum is like 100% trauma, let's say. And on the other end is 100% genetics, or like pure, like you were born with a very strong predisposition to this illness. And then everything in between is sort of a combination of like things that happen to you in your life. You become deficient in a certain nutrient, and some of that is genetic related too. You can have symptoms of bipolar disorder or depression as a result of a certain genetic predisposition to be, to need a certain nutrient. And so anyway, what I do during my initial intake is to try to assess, based on their family history, based on their whole story, because usually it's not just one thing, what are the most likely underlying causes? And then on top of that, what are all of their symptoms? So not just what are their mood symptoms, their symptoms of the main condition that they might be coming in with, but what else is going on? Are they dealing with chronic digestive problems? Are they dealing with chronic headaches? Do they have rashes all the time? Do they have like hypothyroid symptoms where they're, really cold and their digestion's really sluggish and they're really exhausted? Seems like regardless of how much sleep they get or what their mood is, they're exhausted. So then I look at all of that as a naturopathic doctor. I'm definitely looking at not just their health, not just their mental health, but their physical health, all of the symptoms that they're bringing to me. And so that helps guide me as far as like, okay, this person's having a lot of digestive symptoms. So there's something going on in their gut, and that is so foundational to health in general, including mental health. And so then in that case, I'll probably offer some like microbiome testing, or, you know, do some gut health testing to figure out what is going on in their gut. And then that way we can treat it, you know. Or if they're having a lot of thyroid symptoms and I need to go that route, or if they're having hormonal symptoms, like they're having, you know, it looks like they're having depressive episodes as a part of bipolar, but they're actually, it's always during PMS. Like it's every month for a week before they start their period, they're suicidally depressed. I'm like, that might not be bipolar. Actually, that might be PMDD. And so let's test your hormones. Let's figure out what's going on there. And, you know, so it's all about it's all about asking those questions. And then, you know, I also do a physical exam and, you know, do sort of the basics, but it's about asking, getting a really good history so that that guides me to which tests, if I need to do testing. In some cases, you know, if the person is clearly has a, you know, especially if they're younger and they're not really showing any signs of physical health, you know, physical diseases or disorders, and it's very clearly trauma-induced, stress-induced, then sometimes I don't do any testing first. And I'll just focus on starting them on a homeopathic remedy for that stress, starting them on maybe some adrenal support, which is like, you know, herbal stress support, and then see what happens. And then maybe I'll test later. Like if there are certain symptoms that aren't getting all the way better within, you know, the first month or two of treatment, then we can run some tests. But a lot of the time, because the body, like we were saying, is always trying to reach that homeostasis, it's always intending to heal. A lot of the time, if you just give the person that impetus, that, you know, sort of create that foundation for health, then a lot of things get better. So sometimes things are metabolically out of balance, their blood sugar is out of balance, their thyroid's like not optimal, things are just not great. They're not necessarily, it's not diagnosable as a disorder or a disease, but things are just not optimized. And so in those cases, sometimes, like I said, if you just give somebody a homeopathic remedy and some like good quality vitamins, things get a lot better. And then they don't need to be on a bunch of other pills for a bunch of other problems because their body has already started to heal itself.